and welcome to RCI's नवशिखर चैनल. RCI के नवशिखर चैनल में बहुत स्वागत है. We are back with another topic and another couple of experts today. हमारा आज का topic of prosthetics, upper limb. And to adapt this topic, हमारे आज के expert हैं Mr. Vijay Kumar Gulati. He is the senior prosthetics and orthotics, and Mr. M. Dash. He is the manager for prosthetics and orthotics at ALC department in the Northern Railway Central Hospital, New Delhi. For our viewers, if they want to contact us regarding any of their queries or if they want to share any information with us regarding this topic, they can contact us at our toll-free number 1800-112008. Our phone number is 265-11613 and our fax number is 265-11609. Moving to the topic for today, that is prosthetics upper limb. That is, हम आज बात करेंगे कि upper limbs के क्या-क्या prosthetics होते हैं, कैसे prosthetics होते हैं. पहले ये जानेंगे कि prosthetics क्या होता है. Prosthetics is an artificial part, एक artificially made limb to substitute the missing part of the body. जैसे कि अगर हमारे किसी के भी हाथ में एम्प्यूटेशन हुई है, जैसे कि हम बोलते हैं उसका वहाँ पे उसके चोट लगी थी एंड उतना पार्ट जो है उसका रिमूव कर दिया गया है बॉडी में से, तो उस पार्ट को रिप्लेस करने के लिए हम आर्टिफिशियल लिम्स या फिर आर्टिफिशियल पार्ट यूज करते हैं जिसको हम प्रोस्थेटिक बोलते हैं. जैसे किसी का अगर एल्बो के नीचे का पार्ट रिमूव कर दिया गया है तो ये वाला जो पार्ट होगा ये आर्टिफिशियल होगा एंड दिस इज व्हाट वी कॉल एज द प्रोस्थेटिक पार्ट. ये हम एम्प्यूटेशन में भी यूज करते हैं. एम्प्यूटेशन मतलब कि जहाँ पे रिमूव कर दिया गया है पार्ट या फिर किसी वजह से अगर वो पार्ट काम नहीं करता है सपोर्ट पर्पस के लिए हम प्रोस्थेटिक्स यूज करेंगे. प्रोस्थेटिक्स कैन बी यूज्ड इन डिफरेंट पार्ट्स ऑफ द बॉडी, बट आज हम बात करेंगे अपर लिम्ब, दैट इज द हैंड आर्म पार्ट, द शोल्डर, एल्बो, देन वी हैव द रिस्ट पार्ट, द फिंगर्स. दीज आर द पार्ट्स वी गोइंग टू डील विद टुडे. सो सर, मूविंग ऑन टू यू. आज सर हम जानना चाहेंगे कि एग्जैक्ट डेफिनेशन क्या होती है प्रोस्थेटिक्स की.
Like Anna has said, कि artificial limb is a replacement, replacement of a body part with an artificial prosthesis. This is the prosthesis, and prosthesis is being divided into two different parts rather, in lower extremity, and one is the upper extremity, and third one is the cosmetic prosthesis, which is like nose, ear, and all these cosmetics are there. But basically today we'll be talking about upper extremity prosthetic, in which means we have a different type of the prosthesis. Upper extremity prosthesis is more important that because we need to do some function with the hand. So function is involved in the upper extremity, whereas the lower extremity means weight bearing is only, that walking is required. And upper extremity is more important functionally as well as the cosmetically also. देखने में भी अच्छी लगनी चाहिए क्योंकि जो आदमी पहनेगा प्रोस्थेसिस उसको अच्छा लगना चाहिए देखने के लिए. सो ये 2-3 फैक्टर हैं इनके साथ, बट बेसिकली ऑल दिस प्रोस्थेसिस आर बीइंग डिजाइन ऑन द असेसमेंट ऑफ इंडिविजुअल पर्सन. वी कांट से ऑल प्रोस्थेसिस आर सुटेबल टू एवरीवन, सो वी हैव टू असेस. विल गो थ्रू ऑल दिस. मेरे साथ दास साहब हैं, सो विल बी डूइंग दैट सो दैट कि फर्स्ट ऑफ ऑल विल सी द why these amputations are there, reasons for amputation and level of amputations. Then we can go for a different type of the prosthesis which are being used for the different persons. So all this we hope so we'll be able to give you the detail of this. So we have got some slides with us. We'll I think without wasting our time we can go to the slides.
Thank you, sir. First of all, we go to the definition. There are 3 definitions like prosthetics, prosthesis, and prosthetist. The subject dealing with prosthesis, I mean the artificial limb, is called prosthesis, and the prosthesis a device or appliance, or you can say an artificial substitute, which is cosmo-functionally and used to replace a removed, absent, or amputated part of the body. And the person who deals with this, the patients like having the amputated all these sides, is known as a prosthetist. Different levels at which the amputation happened, we are going for the especially for upper extremity, and from top to bottom we're coming to forequarter amputation, shoulder disarticulation, transhumeral amputation, elbow disarticulation, transradial amputation, and wrist disarticulation amputation. All these things, if we a brief idea, sir, I'm transferring to.
So for this, see, we have got the level of amputations. These are the different level, and further that we can have, we get a number of cases with the finger amputation only. Someone has lost one finger, someone has got the two fingers, or the thumb is missing. So these are the different level of amputations which requires attention of the prosthetist or the rehabilitation team to work on that, because this is not a individual work. Teamwork has to be done. We need a therapist also to train them for the use of these prostheses after the fitment, and before that also we need some therapy that stump should be healthy and the range of motion should be enough to operate the prosthesis. ये सब चीज़ें एक यूज़र के बीच में होनी चाहिए. इन सब के लिए हमारी टीम, सब लोग हम मिल के थे, रिहैबिलिटेशन टीम जो हमारी है, सब मिलके इसके ऊपर काम करते हैं. सो दीज आर द लेवल ऑफ एम्पुटेशंस अभी आपने जो देखे हैं. एंड इसके अंदर लेवल ऑफ एम्पुटेशन अपनी मर्जी से नहीं होते हैं. दीज आर बाय द एक्सीडेंट, मे बी बिकॉज ऑफ सम डिसीज, और मे बी समटाइम्स कॉन्जेनिटल deficiencies are there. So these are the after the levels we can go for a further that next of the.
Sir, I would like to ask you before that. सर जैसे बहुत केसेस होते हैं जहाँ इतना पार्ट पैरालाइज्ड हो जाता है, या बिकॉज ऑफ सम रीजन इट इज वीक, इट इज नॉट फंक्शनिंग. उस केस में हम देते हैं.
See, उसमें प्रोस्थेसिस नहीं, उसके अंदर ऑर्थोसिस आती है. दिस इज अ सपोर्ट टू द बॉडी, बिकॉज प्रोस्थेसिस जैसा भी आप डेफिनेशन में देखा, दिस इज अ रिप्लेसमेंट टू द बॉडी पार्ट. But whereas the support to the weak part of the body, that is an orthosis. So we go for the orthotics. That is the orthotic department, in a separate department in this. So those will be the orthosis is to be fitted where the function is not there, to make the weak part to get the functions of this. So we need orthosis.
Different levels you can go. That is shoulder, elbow, wrist, and carpometacarpal. Already sir has discussed these things. So general upper limb management. When a patient comes up to the hospital after amputation, what are the different types of managements we involve? This is involve all members of the clinical team and especially the patient. Be realistic throughout the prescription process, especially with the patient. Inform patient of the support group so that there will be no problem, because when a person lost his limb, psychologically he is deprived and psychologically he is totally upset. So the clinical team overall to discuss these things, and as a management group we have to discuss what are the best preference prosthesis so that he can able to do something functionally with this artificial prosthesis. Functional advantages, cosmetic results, and psychological benefits. Already I have told you these things. The main assessment is acceptance. This is one of the important thing. I have to over to the sir so to discuss this thing. What is the acceptance of this prosthesis?
So assessment, on the basis of the assessment of the individual person, because who has lost the upper limb. So cosmesis is more important for him or the her, whatever the patient is there. But only the thing that we have to consider the patient environment, the living area where they are living, the functions what they were in the profession, and all the basic things are required. But one thing I would like to mention very clearly, artificial hand cannot be compared with the not natural movements or natural hand itself, because it can never reach to the normal hand. Only the thing we try to achieve as much as possible, that we can achieve this possibility of the going to the normal hand itself, but never can reach to the 100% to that. So one has to accept, one has to accommodate himself or herself according to the availability of the different prosthesis that has to be done.
Regarding the upper extremity prosthesis, we have two primary components. That is, one is terminal device, or is known as end effectors, provide some of the functions performed by a human hand to optimize the effectiveness of the prosthesis for a given task. And crane, that means which is support the terminal device to position the terminal device in the desired location. And the function of the crane is to generating enough force personal care and hygienic activities like teeth brushing, shaving, dressing, toileting, etc. Working activities like writing, lifting, sorting, and working level adjustments at floor level, at desk level, shoulder and overhead height. These are the different types. When we design a prosthesis, we have to taking the consideration whether the user is able to do such things or not. And the different types of prosthesis, what we are telling, there are some views for figures. That is transradial, I mean it is below elbow amputation, and we are using the below elbow prosthesis. Then below wrist, or you can tell that another level is wrist disarticulation, or when it is below the wrist and we can able to that a cosmetic hand is used, and then that is transhumeral, or it is otherwise known as above elbow prosthesis. These are the different types we are normally using the prosthesis, that is transradial, transhumeral and wrist disarticulation.
सो सर हम कह सकते हैं कि शोल्डर से लेके यहाँ तक जो होता है उसे हम अबव एल्बो बोलते हैं, एल्बो से लेके रिस्ट तक होता है बिलो एल्बो, एंड रिस्ट ये वाला पार्ट हो जाता है.
रिस्ट से एम्पुटेशन हुआ तो रिस्ट का हुआ, देन रिस्ट से नीचे हुआ, देन पार्शियल हैंड एम्पुटेशन इज देयर, दैट्स कॉल्ड पार्शियल हैंड में भी यहाँ से चॉप हो, यहाँ से. आमतौर पे इसके जो केसेस पाए जाते हैं जहाँ पे चारा काटने की मशीनें होती हैं गाँव के अंदर, या थ्रेशर्स लगे हुए हैं जो जहाँ अनाज को हर साल ज़्यादा से ज़्यादा के, अभी तो आजकल मशीनें आ गई हैं ऑटोमेटिक, जो पहले इसमें चलते थे तो उसमें थ्रेशर के अंदर बहुत सारे लोगों के हाथ जाया करते थे. तो ये एक बहुत बड़ा जो हमारे हिंदुस्तान में रीज़न है, एग्रीकल्चर लैंड जहाँ पे है, जहाँ पे एग्रीकल्चर होती है, तो वहाँ पे ये एक्सीडेंट ज़्यादा पाए. या फिर कहीं पे जहाँ कोई एक्सप्लोजिव वगैरह होते हैं तो बम फट जाता है, तो हाथ में क्रैकर्स बनाने वाली जो कंपनीज हैं, फैक्ट्रीज हैं, वहाँ पे बच्चों के एम्पुटेशन हो जाया करते थे. तो ये सारी चीज़ें जहाँ एक्सीडेंटल होती हैं वहाँ पे ये जो एम्पुटेशंस होती हैं. देयर आर सम ऑफ द अदर रीजंस आल्सो लाइक कैंसर, सेप्टिक और गैंग्रीन. दीज आर द एक्सेप्शनल केसेस ऑफ दिस केसेस आर आल्सो अवेलेबल. Only the thing that once it is amputated, then remaining part has to be utilized to get the functions of the remaining part itself.
सर तो जो अनोमली इसके केसेस होते हैं जो बाय बर्थ होते हैं ना सर,
कुछ बाय बर्थ होते हैं,
तो उस केसेस में भी हम दे सकते हैं.
उसमें भी हम आर्टिफिशियल लिम्ब देते हैं. डिपेंड करता है कि बर्थ से कितना हाथ है. यूजुअली हमने कई दफ़ा देखा है कि बिलो एल्बो छोटा सा स्टम्प रहता है, विच इज़ नॉट रियली गिविंग गुड सपोर्ट टू फंक्शन द हैंड. तो उसके लिए फिर हमें कई दफ़ा उसको अबव एल्बो कंसिडर करके भी करना चलता है. उसके हिसाब से हमें देन वी हैव टू, प्रोस्थेटिस्ट हैज टू डिसाइड कि विच टाइप ऑफ द प्रोस्थेसिस हैज टू बी गिवन. So that's why all the prosthetists should be considered for the good hand or good functions of the hand.
So तो जैसे छोटा बच्चा है सर, बॉर्न हुआ है, उसका शुरू से ही यहाँ तक एल्बो तक का है बस उसका हाथ जो है, तो हम छोटे में ही दे देते हैं उनको.
छोटे में फंक्शनल नहीं देते क्योंकि अभी उसको फंक्शनल कैपेबिलिटी उस बच्चे की नहीं होती है. सो उसको जब तक उसकी समझ नहीं डेवलप होती है, टिल देन ओनली जस्ट वी कैन गिव अ कॉस्मेटिक. तो उसको थोड़ा फीलिंग होने लगे कि वो दोनों हाथ हैं. कई दफ़ा जैसे छोटे बच्चे को तो बिल्कुल नहीं पता लगता, जैसे ही साल दो साल का होएगा तो उसको डिफरेंस नज़र आने लगेगा कि दूसरे लोगों के दो हाथ हैं, मेरा एक हाथ है. डेफिनेटली उसको समझ में आ जाती है. तब तक के लिए उसको एक आर्टिफिशियल, बिकॉज समझाना भी उसको राइट फ्रॉम द बिगनिंग वी हैव टू ट्रेन और वी हैव टू कंसल्ट दैट आपका बाय बर्थ एक हाथ नहीं है, सो दैट ही हैज़ टू प्रिपेयर. उसका दिमाग जो है एकदम उसके लिए प्रिपेयर हो जाता है कि मेरे को एक आर्टिफिशियल हैंड लगेगा करके आर्टिफिशियल हैंड के साथ चलना है. So we have to give cosmetic hand in the beginning, and functional will be only after the maturity, little bit maturity, not complete maturity, but कुछ maturity आ जाए, जो उसकी 10 साल की उम्र हो जाए, 12 साल की उम्र हो जाए, जब वो समझ सके कि how to operate the hand, तब उसको हम उसको functional hand भी दे सकते हैं करके.
Now we are going to the types of prosthesis what we are giving, considering the factors of the technical point of view. That there are two types of prosthesis. One is body powered operated prosthesis and another is external powered operated prosthesis. Body powered operated prosthesis is otherwise known as conventional prosthesis, and the other one is that is a myoelectric prosthesis or bionic prosthesis. Body powered operated prosthesis, the body powered component have been used in upper limb prosthesis for century and are all still commonly prescribed today. The body powered control indicates that the prosthesis user body movements harnessed with control straps and cables to operated prosthesis. Its advantage is low cost, light in weight, and high reliability due to their mechanically simplicity. These prosthesis, what we are telling that regarding the body powered prosthesis, these are very conventional type of prosthesis, but very useful prosthesis that everyone can affordable this prosthesis, and it is mechanically suitable for everybody. Externally powered operated prosthesis, when body power is insufficient to undesirable externally powered components may be used. External power is derived from a source outside the body, because that external power by name itself, it gives that there is no power in the body, so we are transferring some power from external point of source. We are taking power from outside, that is some battery source and other that we'll discuss on the other things. That is, contemporary visions are battery powered electronic devices, pneumatic hydraulic systems and other power sources have been used in this past. That most commonly is that battery power, that is called myoelectric.
सर तो इस केस में हम ये बोल सकते हैं जहाँ पे जो फंक्शनिंग ऑफ द लिम्ब है, वहाँ जहाँ पे भी पार्शियल फंक्शनिंग होगी उस केस में हम लोग बॉडी पावर देते हैं, और जहाँ बिल्कुल ही फंक्शनिंग नहीं है उस केस में हम एक्सटर्नली पावर देते हैं.
Mostly what
whereas sometimes even the person has got the power but still they feel they want externally powered because they don't want to use their body power itself, or they can spend the money for that. As I mentioned, the body externally powered is expensive than the body powered prosthesis. So if someone is able to spend the money to get more layer of that, so they can use it, because they can spend the money for that externally powered. They can also use it, but the preferably should be external should be used for the where the body power is not sufficient. That is to be used itself. But there's a low maintenance of the body powered also. For externally powered means you have to take care of the battery and everything, that you have to take the precautions of the water, fire and everything. You have to be careful about this. There are so many precautions for that.
So like in case of sir, like एक किसी का अगर wrist नहीं है या it is not functional, उस केस में हमने जैसे अगर उसे दे दिया externally powered दे दिया हमने, तो सर क्या इसका मतलब है फिर उसको अपना ये वाला हाथ भी इतना यूज नहीं करना पड़ेगा, उसका ये वाला जो एक्सटर्नली बैटरी से चल रहा है जो, तो वही सारा काम करेगा?
नहीं, द स्विचेस तो बैटरी मसल से ही, मायो मीन्स मसल्स के साथ ही चलेगा. देयर आर स्विचेस अटैच्ड टू द बॉडी इटसेल्फ. Operating, opening and closing is to be done, because terminal device is only that opening and closing. There are limited movements, because हाथ के अंदर हमारी बहुत सारी movements होती हैं. We have got individual movements of our fingers also, even हमारे tips भी move करते हैं. Whereas artificial limb has got opening and closing, and there are some devices which give rotation at the wrist or sometimes flexion extension at the wrist also. There are some, not all. Very few processes are with this movement. Usually there is if rotation is to be done, that is manually. With the other hand one has to rotate, or with some support from the outside one has to operate this rotation of the wrist itself. But opening and closing is the most common thing, that which has got three jaw functioning, that there's only three fingers. These are the working condition. We can hold a pen, we can hold a glass, or we can hold any object grasp के लिए, or that is the only movement. We don't have any other movements like a cylindrical movement. We can't hold a cylinder, or grasp is not there. So there are so many things which are restricted with the artificial limb, but we try to give as much as possible to the patient. The artificially limb is to be given, that maximum movements or maximum use of the prosthesis can be made it. But mostly we have seen the cosmesis is more important for the upper extremity, because people they prefer that look should be very nice.
Okay.
Functionally, if someone has lost one artificial one hand, either it is left or right, the other hand is capable to do all the activities of the daily living, because patient they can manage. But only the problem is when the person loses both the hand, then it is very difficult to operate. There is no any other option, either to have one hand functional, or that they have to do the movements with the mouth or with the head. We have seen many cases, those who are working with the writing with the mouth itself, or brushing and painting, and they are doing very very good work with the mouth also. But even then it is the acceptability of the individual patient.
So like in sometime before, there were many of those prosthetics had come up, like if you just think that if you want to move, so it will move on its own. So are these the externally powered?
Externally powered. These are externally powered, and these are sensory operated.
Sensory operated.
These are because of the sensors. They put a sensor in the nerves itself. Then only from brain we get the command to the sensors. Sensors they operate to the battery, and the hand terminal device. The function is being performed with that.
That we'll discuss after. See, this is the difference of a body powered versus external power. Body powered prosthesis light, quiet, there means no noise, fast, economical, and provides feedback. This is 90% success, and 90% users are available in this case. And when you go to the externally powered, this is heavy, noisy, slow, expensive, no feedback till date, because in particular in India we are using very less amount of myoelectric prosthesis or external powered prosthesis due to its cost effectiveness, because it's very expensive, and those persons who are wishing to use such prosthesis, they have to expense more amount for this for a good result. That's the main concept. These are the body powered prosthesis for the different type, different things are given above. That is voluntary opening for terminal device, and there is a lever at elbow, and elbow cable is there, and in behind your back side there is a harness, there is a control cable, and for the residual limb we have used a socket. That socket gives the connection between the residual limb and the external prosthesis. Terminal device, passive terminal device and active prehension devices. There are two types of terminal devices. One is passive, that is otherwise known as cosmetic. It's only cosmetic point of view, no functional. And the other one is active prehensive devices. It's active, and what we desire to function, as sir told, that there are three fingers, they act like this, and different types of prehensions capabilities there. These are the terminal device of active or functional, you can say. Passive terminal device. The passive terminal devices have no moving parts and require no cables or batteries for operation. They are extremely light in weight and used for cosmetic purpose. The most commonly used passive terminal devices is the cosmetic hand or passive hand. Functions of static grasp or for social acceptance. In passive hand, the thumb is only spring loaded, which will be operated passively to provide better static grasp. They are often recommended for infants and for sports activities. These are two things I am telling you. For the functional point of view, we used to two things, that is for infants and sports activities, and otherwise for normal cases we are also giving that functional purpose. If what we ever discussed earlier, that if the psychological status of the patient is very good and he is able to use it, then only we go for that functional device. Otherwise cosmesis is best. Active prehension devices. That is, there are two things. One is voluntary opening device. Voluntary opening devices are normally held closed by a spring or rubber band mechanism and opened when the control is pulled. Very good thing. That is, the written is voluntarily opening devices. Voluntary opening devices means always when it is static, it is closed. When the spring action works on it, the body power transport to the terminal device, then it opens.
So sir, like you just explained,
Yeah.
for the passive and the active.
Yeah.
So then what is the difference between these two and the body powered and the external? Body powered, we talk that these are not moving. These are
These are moving with the body movements, like voluntary opening we are talking about now, that voluntary opening and hand is there, means these are remain closed, but someone wants to operate it, then a person has to generate the power from the body movement itself to open it, because it is closed with the help of a spring or a elastic. Mostly these are the springs, strong springs are there, so we need a quite good this energy to open it. So one has to do, like we have shown the previous slide, that there is a harness passing through on the back side, on the back of the person, and it passes through the scapulas. The expansion of the scapula, that increases the length of the cable. So with the expansion of the shoulder, or like this movement, the hand, the terminal device, it opens. The spring is being stretched, but once it is released, the expansion of the scapula is released, then this comes to the close. So patient has to be trained to use it, how to open it, and then how gradually pressure has to be released, so that one can grip the things. If someone has to grip a soft thing, then he has to be more careful. because it has to be, it should not be pressed with the spring itself. There is a lot of power on the terminal device. So body powered are with the body movement itself. The body movement has to be like shoulder movement forward, and if there's a elbow lock is to be operated with the shoulder movement like this movement has to be given, or this movement has, there are different movements that which we use to operate the terminal device. Basically we need to operate the terminal device itself.
The object is then grasped with the pinch force proportional to the number of rubber bands or spring used when the cable tension released. The object can then be held passively until the user applies force to control cable to release the object. That already I discussed these things. Good.
So before
Yeah.
moving on to the next slide.
Yeah.
So till now we were discussing about the different types of the upper limb prosthetics. We discussed that there are the terminal devices and then there are the crane devices. We had the different types that are the body powered and the external powered. Body powered are the ones which are used, do not require any battery power, any external force is not required. It is the person's own power that is required. And the external powered are the ones which are used or which works with the battery. They need an external force to be worked with. And we had discussed about the differences between them. Right now we were talking about the terminal devices. That is, there are two types of terminal devices: the passive terminal device and the active prehensile device. We'll continue our discussion after a short break.
This is Aparna. She loves chess and Shah Rukh Khan. Her best friend is Swati. She also has visual impairment. This is Neeraj. He plays many instruments. He loves Mohammad Rafi and cricket. He also uses crutches for mobility. This is Raj Bala. With her husband and daughter. She loves cooking and watching TV. She also has cerebral palsy. Look beyond the disability. Look at the person.
हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन। ओ मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन। We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, जीना इसी का नाम है। मान अपनी जेब से फकीर हैं, फिर भी यार दिल के हम अमीर हैं। मिटे जो प्यार के लिए वो जिंदगी, जले बहार के लिए वो जिंदगी, किसी को हो ना हो हमें तो एतबार, जीना इसी का नाम है, जीना इसी का नाम है।
वेलकम बैक आफ्टर द ब्रेक। ब्रेक पे जाने से पहले हम बात कर रहे थे हमारे टॉपिक प्रोस्थेटिक्स अपर लिम्ब पर। वी स्टार्टेड विद द डेफिनेशंस ऑफ प्रोस्थेटिक्स, प्रोस्थेसिस एंड प्रोस्थेटिक्स। इनमें हमने देखा था कि प्रोस्थेसिस जो होता है स्टडी ऑफ प्रोस्थेटिक्स होता है। देन वी हैड सीन हु आर द प्रोस्थेटिक्स, दीज आर द वन हु आर इन्वॉल्व इन दिस स्टडी, हु प्रोवाइड दीज prosthetics. Then we had moved on to different amputation levels. Amputation हमारा कहाँ कहाँ होता है? Amputation हमने बात की थी. It is when some part of the body is removed from the body. Amputation होता है हमारा shoulder, then we have the elbow, then we have the wrist and the metacarpals. फिर हमने बात की थी assessment के ऊपर. Assessment हम करते हैं जानने के लिए कि उसका environment कैसा है जिसको हमें provide करना है एक prosthesis. क्या उसका एनवायरनमेंट है, क्या उसकी हॉबीज़ हैं, उसके पेरेंट्स कैसे हैं, कितना वो एक्सेप्ट कर रहा है इस फैक्ट को कि उसको एक आर्टिफिशियल बॉडी पार्ट मिलेगा. देन वी हैड मूव्ड ऑन टू व्हाट आर द कंपोनेंट्स ऑफ द अपर लिम्ब प्रोस्थेसिस, दैट आर द टर्मिनल डिवाइस, दैट इज द एंड इफेक्टर, एंड द क्रेन. इट इज द पोस्टीरियर पार्ट which provides the terminal device in the desired location. Then we had discussed about the types of the upper limb prosthesis. There are two types: the body powered operated prosthesis and the external powered. Body powered में हमने बात किया था जहाँ पे कि एक जो हमारी खुद की पावर है उस पेशेंट को उसको खुद की पावर यूज करके उस आर्टिफिशियल लिम्ब को मूव करना होता है. Whereas in case of the external powered, बैटरी से चलता है, वहाँ उसको अपनी खुद की पावर यूज नहीं करनी होती है. वहाँ पे वो सेंसेशंस के बेसिस पे लगा होता है, तो ही जस्ट हैव टू फील इट, ही हैज टू प्रोड्यूस द मसल पावर एंड वो बैटरीज के थ्रू वर्क करता है. देन वी मूव्ड ऑन टू द कंपोनेंट्स. वी वर फर्स्ट डिस्कसिंग अबाउट द टर्मिनल डिवाइसेस. वी डिस्कस्ड अबाउट द पैसिव टर्मिनल डिवाइसेस एंड द एक्टिव प्रीहेंसाइल डिवाइस. नाउ ओवर टू यू सर. अब आगे हम क्या बात करेंगे?
Now we are going to the voluntary closing devices. Voluntary closing devices are normally held open and closed when the control cable pulled voluntarily. The pinch is generated by the amount of force that user applies to the control cable. Prehension, very simple meaning is holding. What we are holding through our terminal device, and it is of two types. That is hook. Again, hook is divided into two types. That is voluntary opening and voluntary closing. And hand, same type. That is voluntary opening and voluntary closing. This is the figure that the spring is used. It's a very strong spring that is voluntarily opening. It's initially voluntary. We are telling it voluntarily opening. That is means just reverse. When it is the force is not applied, it is closed. When force is applied, it opens. And similarly, voluntary closing. When force is not applied, it is initially open, and when force is applied, it is closed. These are the different versions of this figure. You can see these things. Hook. Besides hand is a cosmetic hand is used both cosmesis and also functional, but hook usually used for functional purpose, not for cosmetic purpose. Voluntary opening hook. The gripping surface of the hook fingers may have serrated marking of the rubber line to offer a firmer grasp due to improved friction, because the hook has very firm grasp to hold the object, to hold the piece of job. It's very firm grasp. And hooks are available in right or left. Hands are actuated through a control cable system which is attached to the thumb of the hook, because the spring or the rubber is attached to the thumb of the hook. There are three things available here. These two things, and one is our thumb, and the spring or the rubber band is attached to this thumb so that to open or close. Voluntary closing hook. The voluntary closing hook normally open when the amputee is relaxed and are closed by pulling the control cable, resulting in a direct grading of pinch force. Depending on the force applied, the pinch force at the fingers can be very light or extremely strong. The graded apprehensions may also be of value of selected amputees, such as unilateral transradial amputees with lung stump, very good condition, such as unilateral transradial amputees with lung stump and bilateral upper limb amputees. The mechanical complexity of this device makes it both expensive and prone to breakdown. When condition is coming that when we are using a hook or when we are using a hand, the terminal device is a hook or a hand. When there are two very simple conditions. When the patient is a bilateral amputee, that means he has lost his two of his upper extremities, then we will go for a hook for functional purpose, but there is cosmetically it's not good. And in other cases, if it is a long stump, that means the residual limb is long, then we also recommend this hook. Voluntary opening hand. The hands are used in many amputees, often when on interchangeable basis with a hook. It's also another thing. Sometimes the patient has the option, he can use both hand and the hook. For heavy duty jobs he can use the hook, and for light duty jobs he can use the hand also. The hand are manufactured in many different materials and are available in many different sizes. All hands are covered with inner and outer gloves or only with outer gloves. The gloves will give a natural appearance and skin sets to the prosthetic hands and protect inner mechanism from the dust. The operating principle of voluntary opening hand is same as voluntary closing hook. The common prosthetic hands are designed to provide 3-jaw chuck, that sir has told already, prehension, while other are designed to provide 4 or 5 finger functions. Over to sir to discuss this thing.
So there, like Dasab has mentioned, that there are terminal devices like voluntary opening and voluntary closing. Hook is there, and there's an artificial hand also. Similarly, we have got a different type of the terminal devices which are suitable for the different persons itself. Like some of the people, those who are working in the fields, as I mentioned, that amputations are more in the village area where the cultivation is there or the agricultural land is there, so they lose their hand, and similarly with the loss of their hand they lose their work as well. So there are some of the different attachments which can be attached or detached whenever required by the person itself. There are sickle, or there are hammer is there, the fork is there, the knife can be fitted. So terminal devices can be fitted to the wrist unit itself. One can detach the hand and attach another device which is required. If someone wants to work in the field, they can use the sickle that to cut the crop. So they can attach that attachment for that purpose only. After that they can remove it and again go back with the artificial hand itself. So these are removable and attachable with the other hand itself. So one can use both the things, anything whichever is required. If fork, someone wants to eat with the fork itself, then fork can be attached. So these attachments are also available. These were usually made by the Alimco company, which is the government company in India itself. They were making all these things. So these are available. One can attach or detach. It's a very simple mechanism of attachment and detachment. It takes hardly 1 minute लगता है या 2 मिनट लगते हैं, ये डिटैच हो जाता है. इतना ज़्यादा वक्त भी नहीं लगता है इसके अंदर. सिर्फ यही है कि एक अपना लाइफस्टाइल थोड़ा सा बदलना पड़ता है इंसान को, जिसने भी इसको यूज़ करना है उसके लिए थोड़ा सा ये रहेगा. सो वी हैव गॉट डिफरेंट टाइप ऑफ द टर्मिनल डिवाइसेस फॉर दिस विच कैन बी यूज्ड बाय द बिलो एल्बो. एंड मोस्ट सक्सेसफुल रेट मैं आपको ये बताऊंगा जो आर्टिफिशियल हैंड्स का यूज़ करने का है, दैट इज़ द बिलो एल्बो और द ट्रांस रेडियल जो एम्पुटेशन जो अभी बात कर रहे हैं हम, रिस्ट से लेके जो एल्बो के बीच में एम्पुटेशन है, सक्सेसफुल रेट मैक्सिमम इसी के अंदर आता है. द पर्सन हु इज एम्पुटेटेड इन बिटवीन दिस लेवल बहुत अच्छे से काम करते हैं, बहुत ज़्यादा अचीवमेंट कर सकते हैं उसके साथ में.
सर लाइक अभी हम हुक एंड हैंड की बात कर रहे हैं. हुक वी मेंशन इट हियर, ओके, एंड हैंड तो हम ये पूरा पार्ट मेंशन कर रहे हैं, ये वाला
सेम है. हुक एंड हैंड इज द सेम थिंग.
सेम थिंग.
हाँ जी, ओनली द थिंग वन हैज टू डिटैच फ्रॉम द रिस्ट पार्ट. वहाँ पे हुक लगा सकते हैं. हुक का फंक्शन क्या है, दास साहब ने जैसा बताया, इट इज़ फॉर हैवी ड्यूटी. किसी को हैवी ड्यूटी काम करना है, हैमरिंग करनी है, कुछ और भारी सामान उठाना है, तो हुक कैन हेल्प इट. जहाँ आर्टिफिशियल हैंड उस पर नहीं करेगा. अगर खाली पेन राइटिंग करनी है, सिग्नेचर करने है, देन ओनली द हैंड कैन बी यूज्ड. दास साहब विल एक्सप्लेन यू.
And another thing is hand hook. The difference is the hook is naked part, and the hand is. I told you in previous my views that the almost the hook technique is inserted, and over that a rubber covering is coming, so that it's cosmetically beautiful for the hand. So the basic principle for hand and hook is almost same, beside the heavy duty and light duty, but hand is cosmetically good and hook is cosmetically not acceptable. Now we are coming to voluntary closing hand. The operating principle of voluntary closing hand is same as voluntary closing hook, but the frictional loss in the mechanism are much greater. Through it provides graded preemption compared to voluntary opening hand, but requires continuous cable pull for grasping the object unless passive lock is employed in the hand. In this case, what we are telling you, that regarding the voluntary closing and voluntary opening hand and hook, if the force is transmitted properly, that means from the body part, from your shoulder level to the terminal device, if it is properly transmitted, then the voluntarily closing hook is very good than that of voluntary opening hand. This is the design. This is a hook, and the person is holding the pen through this, and cable tension. This is the cable tension here, open hook, and heavy rubber bands maintains this.
Okay, so हम कह सकते हैं कि hook is more for the fine,
Strong,
heavy
strong, great,
strong,
and heavy
strong.
and
Finer job and both, and sir told you heavier job also, both, because in hand case the finer grip may not become, because when the force transmits inside the hand, there are other things I will discuss later on, that the spring which is coming the dorsal side or upper side. So this is the one defective condition when the exact force is not transmitted. But in case of hook, the exact amount of force what we are transmitted from the upper end of our body to the terminal device is utilized. These are the various types of grips what we are using in our artificial hand or in a normal hand,
life.
normal life. That is cylindrical,
These are the basic
tip,
functions. You must be knowing all that,
Yeah.
because you are
hook, palmar, spherical, lateral, all these things are. And this is a design of a prototype cosmesis of the hand and its mechanism, what you can see in this figure. This is a cosmetic glove. What earlier sir told that regarding the partial hand. Suppose a patient or a person is having partial hand amputation, we don't go for a artificial limb, full artificial limb, because his other parts are very good. So we have to go for a partial hand or a partial cosmetic glove. Suppose the person is having like this, and inside only a glove will come over here, and this will
So
look
but then
nice.
we just discussed like for support and all this, orthotics is involved. So in this case also, sir.
no, this is the replacement
This
of
is
the
replacement
partial
all-
hand only. If some fingers are amputated or the partial hand is amputated, then we need to give some artificially look, that one has to have the look of the hand. So the artificially replacement is the just for the cosmesis purpose only. It can give you the look of the prosthesis of the hand itself, but not the this is the functioning of that.
Because in this case your IP joints or MIP joints will not work. But here the cosmesis will come. Wrist units. After terminal device we are coming the wrist units, types of wrist unit, frictional wrist unit, quick change wrist unit, flexion wrist unit, rotational wrist units. These are various artificial types of or mechanical wrist units what we are using for our artificial limbs, I mean upper extremity prosthesis. These are various design types. And next joint is elbow joint, one of the most complicated joint. And for this, when we are mechanically designed for a prosthesis, what are the different hinges we are using for elbow? These are the elbow units used for transradial prosthesis are usually termed as hinges. The hinges used for transradial prosthesis provides axial stability, permit elbow and extension movements. Flexible hinges, rigid hinges, step-off hinges. For transradial amputation, I mean below elbow amputees, what we are using, sometimes we are giving some elbow hinges to support our external body part, external prosthesis, so that the function can be carried out. And that one of the important point is here, the prosthesis provides axial stability, permits elbow and extension movements. It gives the axial stability of the prosthesis.
Sir, in case if a child has the amputation till here,
Yeah.
then in case the prosthetics is given, so will the elbow will be like movement will be
Yes.
there or not?
Yeah,
The
yeah,
flexion
yeah.
extension
Yes.
would be there or not?
Yeah, there is movement of a flexion extension, and even at elbow we have got a supination and pronation also.
Pronation.
So there's a rotation at this level also. So, but rotation is not possible at this level itself. But we have got another movement at the elbow. You can see
Internal
internal and external rotation of. So this rotation is also possible if the elbow unit is being given. So for the elbow unit, we have got a flexion extension and internal and external rotation. All these movements are there. The flexion and extension is controlled by the cable itself. As we said, body powered prosthesis, there is a cable on the posterior side with the harness itself that operates the elbow unit, flexion and extension. But whereas the internal and external rotation has to be carried out with the other hand itself.
Support.
So this has to be taken the external support. There is no cable for that. So these are the different type of the elbow units are there, but the elbow unit which we are talking about now is for the transradial itself, that where the below elbow, but still we need to give some support. Sometimes if there is a disarticulation at the elbow, so we can't give an elbow unit over here which requires about 2 inches space over here, then it means the elbow joint will go further down, so which is not acceptable by the person itself. So we have to give an external elbow unit which coincide with the elbow unit level at the center of the elbow joint itself.
So same in case of the wrist also, the
Wrist also,
movement
yes.
flexion and extension is present.
Flexion and extension is there, that is there. Flexion of what? That elbow?
No.
Sir,
The wrist
wrist.
movement is not possible.
No.
That
It's
is
not
no,
possible.
No, that is, I told you that there are very few units which are being used for the wrist flexion and extension or rotation at the wrist. This supination and pronation movement is also possible. Only there are very few. Those are the myoelectric hands are available,
So there
but
is-
no mechanical
there are
hand.
static ones.
Yeah, static one. There's a wrist is fixed. Only the pronation supination with the
Passive,
hand.
it's passive.
That is with the other hand itself. It's not a battery operated or not the power operated. Body operated is also not.
Elbow unit. Now we're coming where our below elbow portion is almost complete. So now we're coming to the elbow unit. What are the elbow units available in our market? Elbow units are designed to be used for higher level of amputation, that is elbow disarticulation, transfemoral and shoulder disarticulation prosthesis. Loss of function of the anatomic elbow joint requires a mechanical substitute that permits control flexion extension through a range of 135 degree, but it is desired to lock and unlock the elbow in order to allow control cable displacement for terminal device operation. There are different types of elbow units used for higher level amputation. First I am telling you why you are using elbow units or elbow joint. Number one, for higher level amputation, starting from elbow disarticulation, transfemoral amputation, transhumeral amputation, that means above elbow amputation, and shoulder disarticulation amputation. In these three cases we are using the elbow units, and the function of the elbow units is, besides it gives the cosmetical look of the normal limb, otherwise it gives a functional benefit. First of all, it gives the flexion extension movement and stabilize the entire prosthesis, and also by locking and unlocking we can able to operate the terminal devices. These are the three basic functions, and they are external elbow unit and internal elbow unit. Already sir told that some important cases in which we are using, we are compelled to use the external elbow unit, and otherwise if there is some necessary gap is there and necessary space is there, we will go for the internal elbow joints. external elbow unit. The complete assembly of this elbow unit consists of locking and non-locking joints and used as a pair in elbow disarticulation or long transhumeral amputation. This first of thing where you are using that external elbow. Number one, it is if it is a elbow disarticulation, and number two, if the amputation level is very long, that means it's a long stump, then we are having no space for an internal elbow joint. Then only we go for the external elbow unit. And then external elbow units are used to minimize the prosthetic length sizing. The elbow unit permits full range of elbow flexion and locking the prosthetics forearm in 5 or 7 different locking positions. External elbow units give locking position means suppose we are taking our hands in different positions, this one position and up to our hand. These are 5 to 7 locking different positions were available in our external elbow unit. And internal elbow unit, amputation through the humerus approximately 5 cm proximal to the elbow joint provides adequate space to accommodate inside locking elbow mechanism known as internal elbow unit. From 0 to 135 degree of elbow flexion, the prosthetic forearm can be locked in 11 different locking positions. Control cable force of about 2 to 3 pounds with half-inch excursion is required to operate the elbow lock mechanism. Internal elbow lock mechanism is used. If you see the figure, it's very clear that if the amputation level and the stump condition is minimum and it is adequate to give a space at least 5 cm for a elbow joint, internal elbow joint, then we will go for a internal elbow unit, and then by this internal elbow unit we can give the flexion of 0 to 135 degree of the elbow flexion, and that control cable can be transmit the force up to half-inch excursion, and your amount of force is 2 to 3 pounds. These are the things. Sir, please.
So there are these two different type of the elbow units has been mentioned over here, and there are some advantages and disadvantages of these elbow units, because if we use the internal elbow unit that which is we can see that, so in that it is little bit heavier than the external joint itself, and the internal elbow unit gives the permission for the internal and external rotation, whereas the external knee elbow unit doesn't permit this movement. So this movement is not possible in the external, only flexion and extension is available in that. There is no any internal or external rotation is available in that internal elbow unit.
Yeah.
So elbow unit can give, but only the thing elbow unit is, internal elbow unit is little bit slightly heavier than the external unit. That is the weight wise, and we need a space for the fitment. Like he has mentioned that long stump cannot be accommodated with this internal elbow unit, so we need a space, at least 2 inches space from the elbow unit to fit this elbow unit.
So like you sir has said that we need space. If in case the amputation is here or maybe here, so we'll take this much of at least space.
From elbow we need 2 inches. It should be higher than elbow unit, minimum 2 inches up, the amputation level.
So the area which we are covering for the support, for the support of the prosthesis, in that case that part is not functioning. That part we need to take care of it. Many in cases I've seen that they get ulcers or it's very uncomfortable at that part.
I tell you one thing, the stump you are talking about, which is get
stump,
ulcer, the stump is being used as a force we use the shoulder movement. There is nothing, only the muscles can be used for the flexion and extension only. This movement is being possible. The rotation is not with that stump. The distal end is away from the elbow unit. It doesn't touches the elbow unit. There is a gap between the distal end of the stump and the elbow unit. There's approximately 1 centimeter. So it's a half an inch. That space is available, the gap is available in that. So it doesn't touches the distal end. There is no any discomfort to the patient of fitting this elbow unit. That will be quite comfortable with that. Sometimes we get the scar on the stump itself. Sometimes there is a burn case. You will see the burn, and the skin grafting is being done in the crush injuries also. So there is a sometimes skin problem also with the patient, but we have to accommodate everything in the prosthesis itself. We have to take care of all this.
So in that case, it's done according to the problem of the person.
Individuals, we have to do the assessment only. Then we need to, sometimes we need to give some inner liner also. There are nowadays liners are available with the silicone also. So we can give a soft liner also into that.
Then you're coming to shoulder units.
So moving on to the next slide. till now we were discussing about the elbow unit. Elbow unit, we discussed about the external elbow unit and the internal elbow unit. For the external, we had discussed that it is the external, as it says, ऊपर का जो part है, the external part of it, that is used. And for the internal, there is the internal prosthesis being provided. It's not the upper covering, the skin is not the part. The internal part is the prosthesis. So till now we were discussing about all this. We'll continue our discussion after a short break.
The chief handicap of the blindness is not blindness, but the attitude of seeing people towards them. आइए जानने और समझने की कोशिश करते हैं कि बधिरांधता यानी डेफ ब्लाइंडनेस क्या है। बधिरांधता एक स्थिति है जिसमें दृष्टिहीनता एवं सुनने की शक्ति में कमी आती है तथा जिससे विचारों के आदान प्रदान और रोजमर्रा की आवश्यकताओं की पूर्ति में समस्या उत्पन्न होती है। बलराम एक 9 साल का बधिरांत बच्चा है। वो एक प्री मैच्योर बच्चा है जिसका शारीरिक विकास उसकी आयु के अनुरूप नहीं हुआ था। वो एक निम्न वर्गीय श्रेणी से संबंध रखता है तथा 5 साल से लगातार नेशनल एसोसिएशन फॉर ब्लाइंड दिल्ली के प्रशिक्षण कार्यक्रम से संलग्न है। इन 5 सालों के अंतर्गत उसे रोजमर्रा के कामों में, हलन चलन में, उसकी शैक्षणिक जरूरतों के अनुसार संप्रेषण द्वारा प्रशिक्षण दिया गया है जिससे वो इन सब क्रियाओं में स्वावलंबी बन सके। बलराम बिना किसी सहायता के चाकू से फलों को काट सकता है। उनके छिलकों को कूड़ेदान में डाल सकता है। अपने बर्तनों को खुद साफ कर सकता है। उन्हें सही जगह पर रख सकता है। सही बर्तनों का चयन करके खुद खाना खाता है। एवं पानी की बोतल निकालकर पानी भी पीता है। इन सभी क्रियाओं में वो टेक्चुअल साइन लैंग्वेज से निर्देशों को ग्रहण करता है और अपने भावों को व्यक्त करता है। टेलर फ्रेम और ब्रेलर द्वारा गणित, पठन लेखन में भी प्रशिक्षण प्राप्त कर रहा है। सभी बच्चों की तरह उसका भी एक मनपसंद खेल है। उसे सेल फोन को अपने कानों पर लगाकर उसका कंपन महसूस करना अच्छा लगता है। कहा जाता है, वॉकिंग विद अ फ्रेंड इन डार्क इज बेटर देन वॉकिंग अलोन इन लाइट। कहने का तात्पर्य है कि वो लॉन्ग केन ट्रेवल, टैक्टाइल पाथ, ट्रेलिंग और लैंडमार्क्स द्वारा हलन चलन में भी सक्षम है और व्यायाम संबंधी क्रियाएं जैसे ट्रेडमिल, स्टैटिक साइकिल का स्वचालन भी कर सकता है। कहा गया है, द बेस्ट एंड मोस्ट ब्यूटीफुल थिंग्स इन द वर्ल्ड कैन नॉट बी सीन और इवन टच्ड, दे मस्ट बी फेल्ट विद द हार्ट।
वेलकम बैक आफ्टर द ब्रेक। ब्रेक पे जाने से पहले हम बात कर रहे थे डिफरेंट पार्ट्स ऑफ द एम्पुटेशन। हमने बात की एम्पुटेशन किस किस लेवल पे होता है, फिर हमने बात की कि प्रोस्थेसिस किस किस टाइप के होते हैं। आफ्टर डिस्कसिंग द डिफरेंट टाइप्स ऑफ प्रोस्थेसिस वी हैव मूव्ड ऑन टू कौन कौन सी जगह, कौन कौन से पार्ट पे हम कैसे कैसे प्रोस्थेसिस देते हैं। वी डिस्कस्ड अबाउट द रिस्ट यूनिट्स, देन वी डिस्कस्ड अबाउट द below elbow units, फिर हम आए थे above elbow units पे। Now over to you sir for the shoulder unit.
That's shoulder unit. Functional user of a body powered prosthesis by the shoulder disarticulation amputee is extremely limited. However, passively operated friction loaded shoulder units provide some assistance to do radial activities such as dressing, eating, writing, etc. They are single axis, double axis and triple axis. Usually shoulder units are very rarely used, but when you are taking consideration and very precautions by designing a prosthesis, the shoulder units used to having 3 axial, that is it may be a single axis joint, it may be a double axial and it may be triple axis, to provide a good stability over other distal joints like elbow joints and wrist joints. Now we are coming over to endoskeletal upper limb prosthesis. The body powered upper limb prostheses are also designed as endoskeletal prosthesis that is very light in weight and prescribed for higher level of amputation to restore cosmetic appearance. The endoskeletal transradial upper limb prosthesis has been successfully designed and developed, which permits useful grasp functions besides restoring cosmetic appearance. It is very light in weight, strong and durable. In future, many more endoskeletal upper limb prostheses may be designed and developed, which is replaced present type of exoskeletal upper limb prosthesis. Usually what we are telling here, endoskeletal means it's a cosmetically very good, and exoskeletal, that's conventional prosthesis and cosmetically not acceptable. And what we are telling here, then an exoskeletal prosthesis can be converted to an endoskeletal prosthesis which is very cosmetically well padded and cosmetically well looking, and besides that the functionally and light in weight also. Now the main force transmitting system, that is control cable system of a body powered prosthesis. The basic source of power for prosthetic operation is body powered operation prosthesis is depend on upper body segment motion. The control cable system transmits this body force from harness to various prosthetic operational, that is terminal device, opening and closing, elbow flexion and extension. The control cable system used for 2 types. They are Bowden or fair lead control cable system, and it is employed various terminal fittings which is useful for interchanging of terminal devices. Single control system is used for transradial amputation, and dual control cable system is used in case of elbow disarticulation, transhumeral amputation and shoulder disarticulation. Now the control cable, what we are telling, it's a plastic lead and it is connected from the terminal devices to the harness of the body, which transmits the force from the upper part of the body to the terminal device, and it depends upon the use. There are 2 types, that means dual control cable and single control cable. Single control cable is used only for transradial, I mean below elbow prosthesis, and dual control cable used for elbow disarticulation, transhumeral and shoulder disarticulation. And the main aim is to transmit the body force to the terminal device so that the person or the patient can able to operate his hand very perfectly.
सर लाइक अभी हमने बात की थी एंडोस्केलेटन अपर लिम्ब प्रोस्थेटिस की, तो इस केस में सर जैसे आपने पहले ग्लव्स भी दिखाए थे,
या
इस केस में वो भी यूज आते
हैं? Yes, this can be used.
just for the cosmetic
Yes,
part
yes.
of
Cosmetic
it.
purpose also, that is also being used for that.
After mechanically design the prosthesis, but because in every mechanical design there may not be cosmesis. So for the cosmetical purpose, we go to the mechanical prosthesis with the endoskeletal system. Harness system. The suspended prosthesis from the shoulder so that socket is held firmly on the stump, utilize the upper body motion as a source of power or force and transmit the force via control cable system to operate the prosthesis. I will over to the mic to sir regarding the harness system.
So harness is basically it is a suspension of the prosthesis, because we want to retain the body, the prosthesis to the body, fit it to the body itself. One is the harness system is there, which has got the straps on the posterior side, on the shoulder side, with the on the other side, like a figure 9 and figure 8 he has mentioned. So these are the harnesses, but nowadays if it is a radial amputation or the below elbow amputation, now we give a supracondylar suspension also, which is just over the condyles. You see that condyles are wider than the upper the condyle. So we give a suspension over here, we give a flexible socket, so that this suspension can be given with this supracondylar system that is to be given. So we got the prosthesis these days with the supracondylar, and these are the harness system are being used with the control cable itself, because the control cable is also attached to the harness system. So both the things are together, harness के साथ में लग के and then control cable उसके साथ में attach करते हैं. harness control cable को काम करने के लिए पूरी मदद करती है, उसको ऑपरेट करने में पूरी उसकी हेल्प करती है. दोनों चीजें इसके साथ में रहती हैं.
The types of harness system are figure 9 harness system, figure 8 harness system, and chest strap and shoulder saddle harness system. This is used for shoulder disarticulation and short transhumeral prosthesis cases. This is the figure, very clear cut figure. That is the harness, and we are giving different types of attachments, types of cuff, flexible elbow hinges, double wall socket, cable retainer, cable control, wrist unit, and a hook. Here in this figure there is attachment of hook.
So these are the different components of the below elbow prosthesis. You can see that these are very well shown in this figure. So with the terminal device having a hook, with the hook itself, this is a hook is the terminal
attached
device.
in the terminal device is a hook, and figure 8 harness system is attached here.
Then there is a myoelectric prosthesis. Means this is a technology which is now we should talk about it, because that advanced technology is there in each and every field. Similarly in prosthetic also, advanced technology is there. Myoelectric hands are available. Earlier these were very expensive, and these days are expensive but not much. This can be affordable because there are many people now using this myoelectric hand itself. But most successful rate is, again we will say that below elbow is more successful rate is there, but can easily be used for the above elbow as well. So above elbow के लिए भी इस्तेमाल कर सकते हैं and any level of amputation, but shoulder के लिए इतना अभी successful नहीं है करके, shoulder amputation के लिए, shoulder disarticulation के लिए. So we can say prefer for the below elbow or the above elbow having a good health, and plus the age factor, the users, the person who is going to use it, उसका age क्या है, must be young age to have a good activities are also there. So उसके लिए अगर वो यूज़ करना चाहें तो विल प्रेफर दैट मायो को यूज़ किया जा सकता है, मायो इलेक्ट्रिक हैंड उसको यूज़ करके अच्छे बेनिफिट्स. बट अगेन मैं एक बार फिर से रिपीट करना चाहूँगा जो मैंने शुरू में भी रिपीट किया है, कोई भी चाहे मायो इलेक्ट्रिक हो या बॉडी ऑपरेटेड हो, कोई भी टर्मिनल डिवाइस होगा कैन नॉट बी कंपेयर्ड विद द नॉर्मल हैंड मूवमेंट्स, बिकॉज नॉर्मल हैंड मूवमेंट्स की बहुत सारी एक्टिविटीज़ होती हैं जो हमारी डिफरेंट मूवमेंट्स के दीज आर नॉट पॉसिबल विद इवन मायो के साथ में. कई दफ़ा रॉन्ग कंसेप्शन होता है कि मायो अब तो बैटरी ऑपरेटेड लग गया सब काम हो सकता है. इट इज़ नॉट दैट. द 3 जॉ चक फंक्शन इज इन द बॉडी ऑपरेटेड एज वेल एज मायो के अंदर. वो जो मूवमेंट है सेम है, ओनली द थिंग द सोर्स ऑफ पावर दैट हैज़ बीन चेंज्ड. सोर्स ऑफ पावर जो है उसको ऑपरेट करने का बॉडी ऑपरेटेड से हटा के बैटरी ऑपरेटेड कर दिया गया. दैट इज द ओनली डिफरेंस. इट डजंट मेक एनी डिफरेंस इन द मूवमेंट ऑफ द हैंड्स ओनली. But still there will be a time that हाथ आ रहे हैं अभी. Now we are getting artificial hands which are having more movements in the fingers as well. But अभी हिंदुस्तान में आने में आ तो गए हैं, but they are very expensive, say more than 14 lakhs or 15 lakhs. So that goes means one cannot go for that. They prefer बस फर्स्ट क्लास गाड़ी लेना चाहेंगे उससे अच्छा बजाय कि उसको लेने के लिए. सो दीज आर द थिंग्स दैट विच वी हैव टू. प्रोस्थेसिस मीन्स इट शुड बी अफोर्डेबल ऑल्सो. सो उसके लिए क्या है कि जो टर्मिनल डिवाइस की बात कर रहे हैं, मायोइलेक्ट्रिक प्रोस्थेसिस, दीज आर अवेलेबल, बट दीज आर ओनली the luxurious, we can say, or we can say are good operating. You can have a more comfort in that itself.
Concept of myoelectric prosthesis. What is myoelectric prosthesis? A myoelectric prosthesis is an artificial arm controlled by the very small electric signals from the muscles and powered by batteries. The myoelectric prosthesis is presently the most modern way of rehabilitation of the upper limb amputees. Myo means muscle, and electric, that means when a muscle generates the electric power as a source of power, then we call it as myoelectric prosthesis. Elements of myoelectric prosthesis. Technical specification of an adult size hand. It should give voltage of 6 voltage in DC current, running current with a globe 200 milliampere, opening and closing time 0.8 second, maximum opening 2 to 3 inches, weight of the hand 240 to 350 grams, strength of the grip 20 Newton to 40 Newton or 5 to 10 pounds. These are the very scrutinized specifications of this myo. And electric prosthesis. What can be controlled components? How are the signals generated and used? Level of loss, congenital or traumatic, special consideration in circuit design, children and adults, function in education, social and recreation. These are the various criteria. Before going for a electric prosthesis or myoelectric prosthesis, this should be discussed properly. Otherwise, there is no use of myoprosthesis. What are the advantages of myoelectric prosthesis? Minimal harness, almost harness is very less. There is no control cable, large range of action, control independent of effort. But what are the demerits? It's heavier, slower and more complex. And the myoelectrics, what we are telling regarding the technical specification, it's a signal generation, signal detecting, signal processing. It's generate the signal, detect the signal and process the signal. On board processing, then the used material are and the used parts are the body itself, the prosthesis, the hand, the wrist and the elbow. These are the various things. This can be used for a myoelectric prosthesis, and the basic mechanism of this prosthesis is that is we can use the signal, generate the signal, use it and again process it. How to control the force and how to use this force in our day-to-day life with this prosthesis. Voluntary opening again. Advantages: maintain grip with no input tension, fingers normally closed. Disadvantages: unnatural, inverse oppression, difficult to adjust the grip force, effectively only one grip force level and higher energy requirements. In case of myoelectric prosthesis, we are using a voluntary opening hand, that means initially it is closed. Then these are the first 2 points give you the advantages, that is minimum grip, that means maintain the grip with the no input tension and fingers are normally closed in this case. But the disadvantages are what we feel: difficult to adjust the grip force. What are the various types of gripping force? Suppose we are holding a paper glass and we are holding a normal steel glass. So we estimate what are the different types of range of force that we can put the object, but these things cannot determine. The normal myoelectric cannot determine.
So one has to learn the technique. How much closing is to be done, how much opening is to be done, because this is by the only technique or by the tricks.
Because if the same amount of force
user is used, how much opening is to be done with the battery, because the force person doesn't know how much force is going on. Force is being generated by the motor itself, by the battery current is there. So only the thing, the person is commanding the battery by switching on or off to the switch electrodes. So the one has to have a just idea of it, that how much it is going to open, how much it is going to close. That has to be just by the learning of this process itself.
Training needs to be given.
Training is very much needed for that.
Voluntary closing, advantage: natural, cable tension and grip force is there, proportional control of grip force. But disadvantages: need to maintain cable tension to maintain the grip. Fingers are normally wide open. And this is one of the advantage hand, I mean very developed type of hand, multi-control plus hand. Multi-control plus hand, here there are various motors are used in MIP joints and IP joints to give the motion of the various joints of the fingers and that your smaller joints of the hand. Multi-control plus. Here another thing I will tell you, when you are using a myoelectric prosthesis, we used to insert electrodes. Then electrodes are of two types, that is four single site options and 2 site options. That means they can generate the power, generate the muscle and power in 4 different areas and in 2 different areas. Battery technology. The battery what we are using in the myoelectric prosthesis, that is nickel cadmium, nickel metal hydride, lithium ion technology. There are 3 types of batteries you can use in our myoelectric hand. This is an example of a battery, power plus lithium ion batteries, that is Li2 plus, 30% weight reduction, LED power indicators, 100% increase in uses between the charges, fast charge time, low self discharge, 520 microvolt capacity, integral safety circuit. In this battery, used to, in a myoelectric prosthesis case, they used to give 2 batteries for replacement and recharging, just like our mobile phones. Suppose you are using some 10 to 12 hours per day, so your one of the battery may be discharged for the next day. So the second battery is used for your myoelectric hand.
So this multi-control plus hand that we're talking about,
Yeah.
it's a type of myoelectric.
Yeah. It's a type of myoelectric and developed type of, not only, it's a developed type of myoelectric hand.
Further advancement. But only the thing, as much as we are going to the advancement, that we have to give a more training to the user as well.
Yeah.
Because spending so much money and efforts and everything is being put into the processes means we should get better results and good results out of it also. And results are only possible if we give a good training, and that the learner should also learn all the technique how to operate it. They have to do the practice with that.
Here the different components for a battery system, that how the battery is used. Connectors, that means 2 types of wrist units are connected with this hand for a myo hand. Battery holders, to hold the battery inside the socket of the prosthesis, the different designs are made so that the battery is inserted, just like your mobile phones. The battery is inserted and it is a place, a location is created with this socket so that the battery is properly placed without dust, to avoid dust and water also. Electronic system. And the electronic system of this myo hand consists of 3 things. One is switches, another is electrodes and servo transducers. Switches, what sir told, that in every myo hand there is a switch to lock and to unlock, I mean to open and close. Suppose you want to operate, so switch is on, and you want to don't operate these things, so switch is be closed. And the electrodes is placed, we have to find, the prosthetist is very technically suitable to find the area of the muscle, of the residual muscle, so that where the best signal is coming. Unless otherwise the electrode is not useful, that your huge amount of money is also useless. If the muscle is giving some response with this electrode, then the myo hand can be useful. And then the servo transducer. Servo transducer, when the electrode is inserted in the and it touch with your skin, with the muscle, and it generates a power, and it is transmitted through your battery, that the transducer of this electrode is useful to doing all such work. That means generation of power, generation of signal, and transmit in the terminal device. These are the 3 things.
So the 3 things form the sensor part of the
Yeah.
myo.
Myo, say. Nowadays,
First, yes sir.
nowadays we are getting the switches which are being with the one switch only can be operated. The same switch, once it is pressed or with the generated a pressure with the muscle, with one muscle, this opens, and with the other side it closes also.
Yeah.
So there are switches now in one switch can work for both the things, but one has to do with this. Learn the technique only. There are now techniques are available in this field, but only the thing the user has to learn accordingly. We have to see the learning capacity of the user also.
But every time the message is patient education is must, unless otherwise there is no use. Select re-electric hand system. New hands, new batteries, new electrodes. Always. When a patient comes over for a myoelectric hand, these three things should be there. It should be always new. But in case of conventional, sometimes the used part can be used. Suppose a hand is already used and it can be reused. But in this case, it's better that your battery should be new, the electrode should be new, and your hand system should be new. These are some components. Other features. These are heavy duty digits, safety brake thumb, on off switch in hand. When a myo hand is used, why it is told that it's heavier? Because the hand system, what we are using, the digits, 3 digits, them 3 fingers of this unit, it's comparatively heavier than that of our conventional type or body power type. Because already when we are compare these things, it is mentioned that it is light in weight, but it is heavier and heavier due to these things.
Because it contains a motor. Because this is being operated with a motor. This is with the 6 DC motor is there, which starts moving when it gets the command. So with the movement of the motor, that movement of the finger starts opening and closing itself. So same motor is being used with the opening and the closing. There's a weight of the motor, even though that motor is being used very light in weight and very effectively made it, but still there is some weight of that electric motor is there.
New electric system components, control design, all day capacity, low weight, test button showing state of charge. These are some new designs that are coming to European market, to Indian market, to replace the disadvantage of the myo hand. For example, that RST4 is using such type of things in case of myo hands. Cable operated selected hands, 3 adult size hands, that is 1 juvenile size, dorsal or ventral. Here what we are telling, when we are taking a cable from the hand, there are 2 different positions. Either it can be come out through the dorsal side or it can be come from the ventral side. Unless otherwise, the functional capability of the terminal device is not useful for our prosthesis.
So sir, before moving on to the next topic, till now we were discussing about the new technologies that have come up in the field of prosthesis. We also discussed about the myoelectric prosthesis, which is the very much accepted and the new technology, a developed technology has come up. We'll continue our discussion after a short break.
ऑटिज्म एक व्यापक विकासात्मक विकलांगता है जिसके लक्षण जीवन के प्रथम 3 वर्ष में ही दिखाई पड़ते हैं, जैसे असंगत खेल, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं, शाब्दिक संकेतों पर अभिव्यक्ति न देना।
Where is the cup? देखो, open your eyes, open करो, open करके, open.
नियमित कार्यक्रम परिवर्तन का विरोध करना एवं अवलोकनीय शारीरिक उच्च स्तरीय या निम्न स्तरीय क्रियाकलाप। UNCRPD 2007 सेक्शन 1 ऑफ आर्टिकल 4 निशक्तता के क्षेत्र में कार्यरत प्रोफेशनल के प्रशिक्षण पर महत्व देता है। ऑटिज्म के क्षेत्र में सरकारी एवं गैर सरकारी संस्थाएं कार्यरत हैं, जो भारतीय पुनर्वास परिषद द्वारा पंजीकृत हैं। सोसाइटी फॉर एडवांस स्टडी इन रिहैबिलिटेशन एक ऐसी ही गैर सरकारी संस्था है। कनिष्क 13 साल का एक ऑटिस्टिक बच्चा है जो इसी संस्था से प्रशिक्षण प्राप्त कर रहा है। असंगत क्रियाएं, कार्यकलापों में निरस्ता, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं जैसे बॉडी रॉकिंग और फिंगर रिगलिंग उसमें देखी जा सकती है। उसे मैचिंग और पेस्टिंग, पॉइंटिंग जैसी क्रियाएं सिखाई जाती हैं।
Very good. Glass. Where is the glass? Glass. Very good. कप को टच करो जल्दी से। कप को। Where is the cup? Very good. कप में क्या करता है कनिष्क? टी पीता है। चलो ग्लास। Where is the glass? Very good. चलो बाउल की तरह, बाउल जल्दी से टच करो बाउल को। Very good. बाउल में क्या करता है कनिष्क?
तथा साथ ही साथ रोजमर्रा की आवश्यकताएं जैसे खाना, पीना, कपड़े पहनना, और व्यायाम संबंधी प्रशिक्षण दिया जाता है। ऑटिस्टिक बच्चों को भिन्न भिन्न प्रकार की कार्यविधियां उनके स्तर के अनुसार सिखाई जाती हैं, जैसे कुछ बच्चों के लिए कलरिंग विद इन वन एरिया, मैचिंग एंड आइडेंटिफिकेशन, फाइन मोटर स्किल्स, आई हैंड कोऑर्डिनेशन, कंसेप्ट ऑफ वेजिटेबल्स, फ्रूट्स, बॉडी पार्ट्स, कलर्स पर जोर दिया जाता है तथा कुछ को प्रश्न पढ़ के उत्तर देने में और रोजमर्रा की आवश्यकताओं को पूरा करने में सक्षम बनाया जाता है। इसके अलावा राइम्स, डांसिंग, सिंगिंग द्वारा लेजर एंड रिक्रिएशनल एक्टिविटीज में भाग लेने के लिए प्रोत्साहित किया जाता है। इन सभी कार्यकलापों एवं प्रशिक्षण का एकमात्र उद्देश्य उन्हें स्वनिर्भर बनाना है, ताकि ये डगमगाते पांव सक्षम बन जीवन के एक एक पायदान पर दृढ़ता से आगे बढ़ें और अपनी मंजिल को पा लें। एक तारा टिमटिमाता, उसने आकाश को छू लिया। एक लौ जली कहीं, उसने अंधकार को मिटा दिया।
वेलकम बैक आफ्टर द ब्रेक। ब्रेक पे जाने से पहले हम बात कर रहे थे क्या क्या नई टेक्नोलॉजीज आई हैं, कैसे डेवलपमेंट हुई है प्रोस्थेसिस में, और उन टेक्नोलॉजीज के क्या क्या एडवांटेजेस हैं, क्या क्या डिसएडवांटेजेस हैं। हमने बात की थी मायो इलेक्ट्रिक प्रोस्थेसिस की, जो कि बहुत एडवांटेज इसकी ये है कि इसकी मिनिमम हार्डनेस है और जो एक्शन है वो बहुत सारे एक्शंस, लार्ज नंबर ऑफ एक्शंस वो प्रोड्यूस करता है एंड देयर इज नो केबल कंट्रोल सिस्टम रिक्वायर्ड। तो ये सब एडवांटेजेस देख के इसमें से एक एग्जांपल हमने देखा था मल्टी कंट्रोल प्लस हैंड का, जो कि बहुत ही इफेक्टिव है एंड it's the very upcoming prosthesis. तो अभी we'll talk about sir what is the next thing हम बात करेंगे जो
Yeah, next we'll go for that.
This is for our viewers that if they want to contact us regarding any of their queries or if they want to share any information with us regarding this topic, they can contact us at our toll-free number 1-800-11-2008. Our phone number is 265-11613 and our fax number is 265-11609. Moving back to the conversation today.
Now we are coming to the cosmetics of the, cosmetics of the prosthesis. This is coming the selection of a glove and hand that according to matching of the color of the body, and second one the high definition silicon featuring, that is spectromatch. Spectromatch is totally you can tell it's your body matching color. You can next slide you can show this figure also, and the customs this is the condition of the spectromatch figures, and in which there is no distinction between your normal body color and the artificial gloves what we are supplying and what we are giving the hand system also. You can distinguish between these things, and there are three things I am showing you here: new lung molds, silicon or PVC, and two-tone PVC. And the second one is two-tone PVC. That means sometimes suppose the body color is not fair exactly, then you can go for this type of cosmetic. This is also a cosmetic type, this is also, and this is also sent like this.
सर तो ये जो हम बात कर रहे हैं जैसे ग्लव्स एंड द स्पेक्ट्रो मैच की जो हमने बात की है, तो इसमें सर जैसे अब बहुत बारी होता है इंजरी हो जाती है, एक नॉर्मल हैंड की हम बात करें तो नेल निकल जाता है, तो इस केस में नेल के भी आते हैं रिप्लेसमेंट एंड
yes,
artificial nails.
Artificial nail can be placed. Only the thing that see it's a very minor thing which is may be required. शादी की एज है, एज में बैठना है तो मैरिज में बैठना है, तो इसलिए we get the cases those even एक टिप नहीं है, so they want a single tip also उसके लिए. So we have got the processes. Basically these processes are being used as on the occasions only, on the marriage occasion particularly, of the marriage of the particular person itself. But हम ये साथ में सलाह देते हैं हम लोगों को जो भी इस तरह के यूज़ करते हैं, हम उनको कहते हैं जिनके साथ शादी हो रही है, जिस परिवार में जा रहे हैं आप, उन लोगों को इस चीज़ के बारे में पहले पता होना चाहिए. इट शुड नॉट बी केप्ट सीक्रेट फॉर टाइम, क्योंकि बाद में ये चीज़ प्रॉब्लम क्रिएट नहीं करे, आपके फैमिली के अंदर फैमिली को तोड़ने का काम ना कर दे. तो इसलिए आप बेशक बनवाइए, लेकिन सिर्फ उनको ज़रूर बताइए जिनके साथ आप जुड़ने जा रहे हैं, जिस फैमिली के साथ आप जुड़ रहे हैं, जिस आदमी के साथ आप जुड़ रहे हैं, औरत है या आदमी है, वट एवर द जेंडर इज देयर. लड़की बनवाती है तो लड़के को पता होना चाहिए, लड़का बनवा रहा है तो उसकी वाइफ को, होने वाली वाइफ को पता होना चाहिए कि आर्टिफिशियल लगाया हुआ है. ठीक है, आम पब्लिक को नहीं पता लगेगा, तो उसके लिए ये आर्टिफिशियली कैन बी यूज, उसके लिए बनती हैं, बनाई जा सकती हैं. एवरीथिंग इज अवेलेबल एंड वी डू दैट ऑल्सो. हमारी प्रैक्टिस में वो चलती हैं सब चीज़ें, ये बनाते हैं हम लोग. बट वी मेक इट वेरी क्लियर टू द पर्सन. हमारी राय देना एक हमारा फ़र्ज होता है, उसके बाद उनका अपना होता है इस्तेमाल करें उस राय को या नहीं करें. तो ये सब चीज़ें जैसे हम अभी तक मैकेनिकल और ये मायोइलेक्ट्रिक हाथ के ऊपर बात कर रहे थे, नाउ दिस आर द कॉस्मेटिक थिंग्स आर देयर. जैसा दास साहब ने बताया, दे आर मैचिंग कलर्स आर देयर. तो सो दिस आर द सिलिकॉन cosmetic processes are there which are being matched as per the color, because if you see our hand, so one side it is fair and the other side that color is different. We have got two different colors. So if this silicone is being made in a different colors, you can just see the colors, different colors are there. So these colors are being matched with the silicone prosthesis. कलर्स, इम्प्रेशंस, ऑल दिस डायमेंशंस, जो भी इसके जो हाथ की लाइनें हैं वो सारी पूरी मैच करके बना दी जाती हैं. So these are the cosmetics.
Yeah.
That's what दास साहब बता रहे थे.
So I don't know whether this question is valid or not, but I just wanted to ask, like हमारी thumb prints होते हैं, finger prints होते हैं, तो ये भी चीज़ maintain की जाती है?
नहीं, prints को नहीं, finger prints को नहीं कर सकते हैं, ये जरा मुश्किल काम हो जाता है. But sometimes you know, जैसा कि सिलिकॉन के अंदर है, नहीं बनेगी, वो नया ही प्रिंट बनेगा, उसके लिए कुछ नहीं कर सकते. बट जैसे पीवीसी की बात कर रहे थे, दास साहब ने दिखाया कि पीवीसी के भी बनाते हैं. सो पीवीसी का बनाने के लिए हमें उसका एक मोल्ड बनाना पड़ता है, उसके मोल्ड का साइज़ लेना पड़ता है. तो साइज़ के लिए क्या करेंगे हम, देखिए जिसका हाथ एम्पुटेट हो गया, हमारे पास उसका हाथ का साइज़ लेना बड़ा मुश्किल काम हो जाता है, क्योंकि कैसे साइज़ लोगे, वो दूसरा हाथ है जिस हाथ के लिए लेना वो नहीं है. तो हम लोग क्या करते हैं, हम उनको कहते हैं कि आपका कोई भी सगा नज़दीक का रिश्तेदार, ब्रदर सिस्टर, जो भी आपके साथ में है, हो सकता है उनका हाथ का मैचिंग आपके हाथ के साथ मैचिंग बनती हो, कई दफ़ा मिल जाती है, फादर के साथ मिलती है, बेटे की मिल जाती है, या सिस्टर की मिल जाती है, ऐसा इनके साथ। तो मैचिंग वाला हाथ उनको लेके हम मेजरमेंट उस हाथ का लेते हैं। कास्टिंग जो करते हैं, जो कास्ट लेते हैं, उनके जो साथ में सगे आए होते हैं जिनका हाथ उनके साथ मैच करता है, नहीं करता तो हमें ढूंढना पड़ता है कि किसका हाथ इनके हाथ के साथ मैच कर रहा है। कलर मैच करे ना करे, लेकिन फिंगर्स की शेप जो है वो मैच करनी चाहिए। सो उसके अकॉर्डिंगली हम उसका कास्टिंग करते हैं, मेजरमेंट लेते हैं, उसका मोल्ड बनवाते हैं, फिर कलर उस जिसको फिट करना है उसके साथ कलर मैचिंग करके उसकी वो फिर हाथ को बनाते हैं। सो इट्स ए प्रोसेस ओनली, वी डू अवर बेस्ट। जो प्रोस्थेटिस्ट होते हैं वो अपनी मेहनत से, अपने तरीके से, अपनी टेक्निक को यूज करते हैं, अपनी स्किल को यूज करते हुए वो बेस्ट आउटकम देना चाहते हैं जो हमारे यूजर्स हैं। वी ट्राई टू हेल्प आवर फ्रेंड्स, दोज हु आर अनफॉर्चुनेट, कि जिनका हाथ कट जाता है या कुछ हो जाता है। So we try to help them itself in this way itself. So now we'll come to the socket design.
Whatever the case may be, I mean it may be a myoelectric prosthesis or an conventional prosthesis, but the one of the technical part is that is socket. The socket is one of the part which directly contacts with the residual part of the body, and this is the first link and which transmits everything, that is force, control cable, everything transmits from the residual part to the socket and then after the terminal device. So socket design for every professional and every prosthetist, they should know very careful regarding the design of a socket and how to manage with the amputees. Regarding the socket design, there are 4 types of socket design. One is beam socket, Munster socket, northwestern type socket, and transradial anatomically contoured socket, track socket. We can tell it track socket. And electrodes are in case of myoelectric, we are telling you regarding the socket of a myoelectric hand. Electrodes are fixed inside the socket. It is desired that the electrodes should have good contact with the stump without slippage or without any relative movements under all normal loading condition. The general desire also for freedom from harness, so that the socket should be made totally self-suspending. Therefore, the socket for below elbow amputee may be made based on Munster principle or more acceptable supracondylar suspension with decreased mediolateral measurements above the condyles of the humerus, thus freeing the anterior posterior dimension for obtain maximum flexion extension range of movements. Forearm setup can be designed as usual manner with the provision for fitting batteries. The same may be joined with the socket by double wall lamination or may be joined with the socket by riveting the forearm set of incorporate wrist housing for attaching wrist unit and terminal device. Here what I am telling you, the socket, in case of myoelectric, the electrodes, what I am telling that it's an electronic device which is very useful for transmitting the body power. This is placed inside the socket. When we are taking the measurement of the stump, the socket is placed when the electrode is placed inside the socket in such a way so that the maximum muscle power can be procured from this body force, so that this can be used in our prosthesis. Comparison of socket: northwestern socket, beam socket, Munster socket. If someone contacts this time in any professional, they can ask right time this, because this is the right time to ask any question for regarding this use. Northwestern socket, beam socket, Munster socket. The northwestern socket is casting angle is 90 degree, casting angle of beam socket is 60 degree, and for Munster it is 90 degree. Suspended over the olecranon and epicondyles. The beam socket is suspended by a rigid beam curved during the rectification, suspended over the olecranon and antecubital fold. Not suitable for very short stump in case of northwestern design, but beam socket not suitable for more than 50% long stumps and stumps with prominent epicondyles. Then for Munster socket, suitable for short stumps, maximum length 50 to 55% of opposite limb. These are the different 3 types of socket I am telling you. Beside the track socket, that northwestern socket, beam socket and Munster socket. Munster socket is used simple, very short stumps, and these are the some technical points regarding how to cast it and how to take the measurements.
And the selection of the socket is totally depending on the prosthetist itself, because they have to assess the patient, stump का range of motion कितना है, उसका strength कितना है, उसके अंदर muscle power कितना बाकी है, and length कितनी है. All these things has to be considered. Age factor of the person who going to use the prosthesis.
Yes.
Everything has to be considered. Sometimes we get the hyperextension at the elbow also. So all these things has to be considered while we are assessing the patient, assessing the user. After that, only the selection of the socket is to be done by the prosthetist only.
Yes. Transradial anatomically contoured socket, how it works. Muster socket suspension relies primarily on anterior posterior comparison, and the northwestern socket uses mediolateral, and the track uses both anterior posterior and mediolateral. Contouring area, the anterior cubital region, the olecranon region, the epicondyle region, the distal radial region, and the wrist extensor and the flexor musculature. These are the various parts of the stump that we are showing in the next 2-3 slides. That what are the regions which, when taking the measurement of the residual limb, what are the various parts we should consider to get a better socket. Impression technique. Before measurement and before taking a cast, we should give some impression so that the negative cast will take it, and after that socket can be designed very efficiently. That is anterocubital channel, this is known as AC. Securing the bicep tendon in the cubital fold area between the index and the middle fingers. Supraolecranon region, directing the pressure to an area approximately 1 to 2 centimeters proximal to the olecranon process. Epicondyle region using the thumb and index finger. And these are the various parts, that is lateral trim line, cubital fold, lateral epicondyle, radial head, olecranon. Distal radius, cubital fold, anterior medial lateral trim line. These are, when the patient comes over to the prosthetist, these are the things before taking the cast they should consider carefully, unless otherwise the socket may not be designed properly. And these are some areas in which the force comes, and maximum pressure, minimum pressure. These are some, just for example, AC, anterior cubital channel, it's one of the important part. DRR, distal radial relief, wrist flexor extension region, that means where muscle is very much efficient. IOC, infra olecranon compression, ORC, olecranon region counter, ERC, epicondyle regional contour, ICC, infracubital compartment. In a socket, particularly in a below elbow socket, these are the various regions which should be properly considered, and then after, when the socket comes for fitting, it will be useful, very much useful. Comparative analysis of ROM, range of motion. So when a patient comes over to a prosthetist for fitting of a prosthesis, these are the various conditions, and we have to analyze the ROM, that means range of motion, what are the range of motion he has, and how we can design a socket. Comparative analysis, patient's elbow was positioned at approximately 90 degrees and radiographs were taken in the sagittal plane, one unweighted and one with passive weight. When patient comes for measurement, then that what we are mentioning here, radiographs measurement without giving proper weight and with a weight, so that the patient has the capability how the muscles are working. We can measure, we can analyze how the residual muscles are working till day, so that the socket and for the fitting of electrodes will be beneficial. Sir, please.
So we are talking about the range of motion. This is the thing very important, as I told you in the early time also, that whatever the functions we have to achieve for the terminal device, those are being operated by the residual muscles only, which are the muscles and the joints are remaining with the person. Having a good stump, good strong and healthy stump will be able to give more better results in the means of that giving a terminal device, the function of the terminal device, and the holding any object or operating the system and using the artificial hand will be all depending on the range of motion of the remaining stump and the muscle power of that stump. As you know, the therapist, they have to work on it. If it is weak, then it has to be make the stronger one to enhance the muscle power. That has to be done to get the range of motion. All these things has to be used. So myoelectric hand, it doesn't require much of the muscle power, but only still we require some of the muscle that has to activate the electrode, activate the switches which are been mentioned by the Dasar, that this electrode will operate the battery and then battery will work, send the transmission to the motor itself, and then the function terminal device will work on the basis of that command itself. So this, to give the command, still we need some muscle over there, and the socket which is being mentioned earlier also, the socket fitting should be snugly fitted. It should not be loose, it should not be so tight that muscles are very all the times electrodes are functioning all together, but only the thing, it should be snugly fitted, should be well in control of the person of the using that prosthesis itself.
See, this is a myoelectric socket. What are showing you, the EMG electrode are placed inside the socket, which will directly touch to the muscles of the remaining body part. If it is not properly, what sir mentioned, if it is not properly come contact with the muscles, then no signal will come. And if there is no signal, so that my hand, that means costly hand will be no use. And another thing, self-suspending socket, because what we are designing the socket, it's a self-suspending socket. No much harness or control cable is used, and that battery is there to amplify these electrodes into terminal device for opening and closing. These are the various features of a myo hand, and this is one type of socket design here, and where we can place your battery and electrodes inside the socket. These are the terminal devices, that different types of hands controlled with other wrist units in this figure. Fitting the myoelectric prosthesis. First, patient selection is the one of the most important criteria. Which patient is useful for myo hand or not. Assessment, that sir told, to assess the patient clinically and as well as psychologically. That is one of the important factor. Stump length also, the length of residual limb, what the remains, it's also important factor. Fabrication procedure, examination, control site selection, cast taking and fabrication of socket, socket fitting and trial with temporary prosthesis, completing the prosthesis. These are the various usual process for a prosthetist to design a prosthesis and to fabricate it, to fit it, to give the training to the patient. First of all, examination, that sir told, to examine the patient in different areas, different considerations regarding the muscle power and its psychological status, his social status, all these things is considered. And the important thing is technical point of view, that is control site selection. Which site you use to place the electrode so that your maximum EMG force can be generated. Cast taking means to take a cast of this, to take a impression, take a negative impression of that stump, so that this will help the prosthetist to design the socket. Socket fitting, after making the socket, if the fitment, we have to trial whether the designed socket is properly fitted and that electrode where you have placed is useful or not. These things should be checked properly, and if the socket fitment is proper, then after the other attachments will be coming later on. That is complete for completing a prosthesis. Completing the prosthesis, Definitive prosthesis can be constructed with the removable inner socket, which is usually riveted with the forearm cell, or the prosthesis can be constructed with the two wall bonded together in double wall construction. While preparing forearm section, appropriate provisions should be made to incorporate battery. The cable outlet of the electric hand is attached to the 4-way pin plug or cable connector plug, and at the sides both electrodes cable are attached. Centrally, the cable from battery is attached to the connector plug. All the cables and connector plug are kept inside the forearm cell. Battery may be kept with the prosthesis if stump length permit, or it may be kept externally with the help of battery clip. So this is one of the thing what we can tell. After socket, there should be forearm cell. And the forearm cell is attached to the socket with all the necessary items. That means battery and that your switch. All this should be inside the forearm cell. There will be no outside looking of the cells.
So this is the complete part of what we need to do in prosthesis, things that need to be included, things that need to be taken care.
Yeah, taken care. These are the main things here.
So you want to?
Yes.
So I would like to just give a suggestion to our viewers that if somebody is amputated above this upper extremity hand is amputated, and one should contact a good prosthetist to get a good information about the prosthesis first before going for any fitment of the prosthesis, because getting any fake information like anything can be done with the artificial hand, it is not possible. But only the thing you should learn from a prosthetist wisely what are the things are possible, which are not possible, should learn about it, then only select whatever the hand you feel you want or you like it. So this is I would like to suggest our viewers and our whatever the amputees are there, if they are watching this program.
Thank you so much, sir. So in today's conversation, in today's conference, we discussed about the topic prosthetics upper limb, the prosthetics for the upper limb. We started with the different definitions, what is prosthesis, what is prosthetics, and who are the person who deal with this field. Then we had discussed what are the different amputation levels, that is the shoulder level, then we have the elbow level, the wrist level, and then we have the metacarpal levels. Then we had talked about how much the assessment is necessary, the acceptance of the fact that how much the person who will be getting a prosthetics, it's necessary for him to accept it, for the family to accept it, and assessment is also necessary in the field that what kind of a work does a person do. In that case, that type of a prosthetic is given to the person. Then we had discussed about the different components of the prosthesis. These are the terminal device, that is the end effector, and the crane, that is the posterior, the terminal device in the desired location. Then we talked about the different types, the body powered operated prosthetics and the external powered operated prosthetics. Our experts had shown us the figures and they had explained to us what is the difference between them. The body powered are the ones in which the manual, our own power is required, whereas in the external powered, the external force is required, which is given by the different batteries, the different electrodes that are available in the prosthetics. Then we discussed about the passive terminal device and the active prehensile devices. Passive are the one which does not have any mobility, whereas the active ones are which have the different joint parts and they are mobile. Then we had discussed about the different voluntary closing device, in which we had discussed about the hand voluntary opening and the hand voluntary closing, and the hook voluntary opening and the hook voluntary closing. Then we discussed about the different units, the wrist units, in which we have the different kinds of prosthetics, that is a frictional wrist, then we have the quick change wrist unit, then we have the flexion wrist unit and the rotational wrist unit. Then we later discussed about the elbow unit, in which we have the flexible hinge, the rigid hinge and the setup hinge. Later we discussed about the elbow unit. Moving on to the upper elbow part, we had the external elbow unit and the internal elbow unit. We moved on to the most upper part, that is the shoulder unit, in which we have the single axis, the double axis and the triple axis. According to these types, we have the different prosthetics available for the different levels. Then we moved on, what are the endoskeleton upper limb prosthetics. Then what is the control cable system, in which we have the different cables controlling. And then we had the harness system, what are the different kinds of harness system, that is the figure 9 harness system. Then we have the figure 8 harness system, chest strap and the shoulder saddle harness system. These are the different kinds of harness system we discussed about. Later we moved on to the new technology that have come up with the myoelectric prosthetics, in which we discussed about what are the different concept about it, the different elements that are used, what are the advantages and the disadvantages that are used. We also discussed the fitting of it, and the example of it, the very accepted one, was the multi-control plus hand, in which we also discussed that the different battery technologies that have come up for it. We also discussed about the socket design, that is the brim socket, the NW and the track socket that we had discussed. Lastly, we were discussing about the cosmetic part of it, that how much, even if the prosthetics is provided, there is always a personality conscious about it, that it's not looking good, it's something different from the others. So we need a cosmetic mold for that, and which we have the different select, in which we had discovered how to select the gloves. Then we had to match the skin, therefore which we need the spectro match. These are the different topics we today discussed about. We'd like to thank our experts today for taking out their precious time and their valuable knowledge with us. That is all for our today's conversation. I hope you liked our show. Thank you for watching us.